I'm Daniel Karlsberg, board-certified cardiologist and fellow of the American College of Cardiology. I made this video to help explain what we know so far about coronavirus and the heart. As you already know, earlier this year, health officials around the world started seeing more and more cases of a highly contagious viral respiratory infection. And in March of this year, the WHO officially declared coronavirus a pandemic. So far, we know that coronavirus disease, also known as COVID-19, is caused by a type of coronavirus called SARS-CoV-2. This stands for Severe Acute Respiratory Syndrome Coronavirus 2. As more and more people around the world continue to get sick, health professionals are seeing lots of people who show up to the hospital with this respiratory infection. The most common symptoms appear to be shortness of breath or difficulty breathing, cough, fever, chills, muscle pain, sore throat, or new loss of taste or smell. We also know that statistically the majority of people will experience a mild or moderate illness which does not require hospitalization, but some people are at very high risk for a severe illness. Older people, people with diabetes, people with lung disease, and people with underlying heart disease are at an increased risk. As a cardiologist, I've been getting a lot of questions like how can a viral respiratory infection actually affect the heart? So let's break that down a little bit. When someone encounters a virus, like in the case of coronavirus, you become at risk for having an infection. If you do get infected, the virus tends to infect your airway, from your nose to your lungs. Once your body detects this infection, it will mount a systemic immune response. It also goes into a widespread inflammatory state with a lot of physiologic changes to help fight off the infection. We normally can see evidence of a respiratory infection on a chest X-ray or a CT scan, but there's always a lot more going on than what we can see with just imaging. So let's talk about some of those physiologic changes that happen with any infection, including coronavirus. One of the first things that happens when someone gets infected is a process called vasodilation. This means that the arteries carrying oxygenated blood around your body dilate and get bigger, so they can deliver more blood to your organs and tissue beds. To help continue circulate blood, we see an increase in heart rate, as well as numerous hemodynamic changes in the circulatory system, especially if you become dehydrated. The combination of these changes and the extent to which they happen puts a lot of stress on every organ system, especially the circulatory system and the heart. So if you or someone you know has had previous heart surgery, if you have certain congenital heart diseases, if you have heart valve disease or you've had a heart valve replacement, if you have uncontrolled hypertension, coronary artery disease or prior heart attack, congestive heart failure or arrhythmia, the ability of your heart to compensate and cope with these changes may not be as robust as other people. This can lead to an exacerbation of one of these underlying problems, as your body mounts its immune response, enters an inflammatory state, and tries to fight off the viral infection. That's why supportive care and knowing about these underlying conditions is critical. There's another component, though, to a viral infection which can also affect someone's heart. We know that sometimes some viruses can infect the heart muscle itself and cause damage at a cellular level. This is called myocarditis. We also know that if enough of this occurs, it can aggravate coronary artery disease, causing a heart attack. If there's extensive cellular damage, it can cause congestive heart failure and arrhythmia. While we don't know exactly how often myocarditis happens with coronavirus just yet, we do know that these are the types of things that can happen to your heart with similar viruses. Coronavirus is new, and we're learning a lot every day. We'll keep things up to date as we move forward, but if you or a loved one has underlying heart disease, I can't stress enough the importance of basic things. Wash your hands and keep a safe distance to prevent an infection in the first place. To learn more, go to Learnyourself.org.